Hi, I'm Delaney Hall and this is my medication administration video. First, I'm going to perform hand hygiene and check my patient's orders and make sure there are no labs or medications that interfere with the patient's allergies, which I can see our patient is allergic to codeine. I'm going to compare the orders against those of the MAR. First, I have erythromycin 250 milligrams, PO 4 times a day, and I will be giving his first dose at 8 a.m. I have the varicella vaccine, 0.5 milliliters sub-Q 1 time, and then dexamethasone, 4 milligrams per 1 milliliter intramuscularly 1 time. I will be doing all of these this morning at 8 a.m. and yeah, okay. So first, I will get erythromycin. I have a 250 milligram capsule. So erythromycin 250 milligrams, PO at 8 a.m. Expiration is 2037, so I am good to go on that. Okay, next I will prepare the varicella vaccine, 0.5 milliliters sub-Q. Expiration date is 2030, so I'm good on that. I need 0.5 milliliter, 1 milliliter syringe with a blunt tip. And I guess 25 gauge needle with that. Okay. First I will clean the top of the bottle twice. Okay, going to drop back 0.5 milliliters of air. Inject the air, invert, drop back 0.5 milliliters. I will switch over to my 25 gauge safety needle for a subcutaneous injection. Okay. Next I will prepare my dexamethasone 4 milligrams per 1 milliliter IM injection. Dexamethasone, expiration date 2030, good to go on that. I'm doing 1 milliliter, and I will use a 3 milliliter syringe. We'll clean the top. Draw back 1 milliliter of air. Inject the air. Draw back 1 milliliter. Now I will switch to a 23 gauge safety needle for an IM injection. Okay, now that I have prepared all of my medication, as I head to the patient's room, I will double check these. Okay, first I have erythromycin, 250 milligrams, given by mouth and capsule 4 times a day, and I will be giving his first dose at 8 a.m. this morning. Next I have 0.5 milliliters of his varicella vaccine, which I will be giving subcutaneously at 1 time. Next I have dexamethasone, 4 milligrams per 1 milliliter, given intramuscularly at 1 time. And this is all for the patient Jamie Wheeler. Knock, knock, knock. Hi, Mr. Wheeler. My name's Delaney. I'm going to be your student nurse today. Shut the door for patient privacy. Alright, I have your morning medications here. Looks like I will be giving you 3. Will you verify your name and date of birth for me? Okay, perfect. I see you have an allergy bracelet on. Can you tell me what you're allergic to? He tells me codeine. I assure him that he won't have any complications with these medications. Regarding his allergy. Okay, so last check. First I have erythromycin, 250 milligrams, PO 4 times a day, beginning his first dose here this morning at 8 a.m.
Smart, come on.
I will assess his ability to swallow first by offering him some water. Alright, Mr. Leah, I'm going to sit you up just a little bit so you can take your medication. Alright. Do you mind drinking some water for me first?
You said it.
Good, okay. So patient's ability to swallow is intact.
Yeah, you did.
Before I give you these, I'm going to go over some of the side effects you may experience with these medications. So first, I have your erythromycin, which is an antibiotic, and this is going to help with your confusion. Some common side effects are nausea and vomiting. Next, I have your varicella vaccine, and this is the chickenpox vaccine, and possible side effects are fever, redness, or a rash, and then just slight tenderness where the shot was given. And lastly, I have dexamethasone, which is a steroid. It's an anti-inflammatory. Possible side effects of this are depression, anorexia, nausea, and hypertension, so we will be watching for those. And if you have any of these effects, make sure to let me know. Okay. So first I will give you your erythromycin. I'm gonna make sure my patient swallowed his medication. And I will ask him if he needs any water afterwards. Mr. Wheeler, do you need water to swallow your medication? He says he does. So I give him his water. Next, I'm doing his varicella vaccine, 0.5 milliliters subcutaneously. So I have that here. First, and I will be giving his injection into his abdomen. I'll go assess skin integrity, and it is intact. I'll go 2 inches away from the umbilicus. I will clean the area. Okay, you'll feel a little pinch here, Mr. Wheeler. And it's subcutaneous, 45 to 90 degrees. inject it slow and hold for 10 seconds. Okay. Looks good. Let's get a little gauze on there with some pressure. Okay, looks good. Next, we are going to do your dexamethasone 4 milligrams per 1 milliliter intramuscularly. I could do this in the retrogluteal area or your deltoid, but we will be doing your deltoid today. First, I'm going to assess the area. Skin integrity is intact. I will clean the area before giving the injection. Go 2 fingers below the acromion and create a V towards the axillary line and give my injection in the middle of that. So create my V, and then I'm going to pull the Z-track method and giving an IM injection at 90 degrees. You'll feel a little pinch here, Mr. Wheeler. Give the medication slow and then hold for 10 seconds. Okay, good job. A little bit of gauze to help with bleeding there. Okay, looks good. Okay, Mr. Wheeler, all of your medications have been administered. I will look for adverse effects and be back in to check on you. Are you comfortable there? Okay, I'll lower the bed a little bit for you. I'll make sure my patient's comfortable, has his call light with him, bed is at its lowest position. I will document the drug, the dose, time, and route of administration, and I will be back in to check on my patient. And I will dispose of all my sharps in the sharp container and garbage that needs to go in the garbage.